It is safe to assume that almost all Namibians have experienced the loss of a loved one or news of the sudden death of a close friend due to the dreaded coronavirus. On a daily basis, a name known pops up on our phones or shared on social media. Announcements of death have become more frequent. Burials are an everyday scene, casualty departments full to capacity, and people placed on oxygen fighting for their lives. Experts warn that the peak of the third wave is yet to set in, as footage of such disturbing nature threatens to become the new normal. It is clear that this pandemic will leave the economy crippled long after it is gone. But how long will the nation take to heal psychologically? There are many stereotypes when it comes to mental health, and as a result, not many want to be associated with its discussion. But the destruction left in the wake of the still raging pandemic has further detrimental effects on survivors of COVID-19. On the panel with First Lady Monica Kengos sits a mental health expert, a clinical psychologist, a psychiatrist, and church leaders.
Those that have suffered from COVID, those that have lost their loved ones from COVID, especially the children, looking at them losing both parents at the same time. It is not mourning as usual, it's not grief as usual.
Though every living being on earth will eventually die, Njaba says that the progression of death caused by COVID-19 is too fast. Survivors are left with too many things to deal with at the same time, and in many instances, she says, many who succumb are the providers in their family. During the discussion, Monica Kengos stated that she was surprised to learn that Namibia only has 10 psychiatrists and only 4 of them work for the government.
That's a shocking number for me, that is, in a country with a mental health burden as heavy as ours that goes back to our past. To only have 10 psychiatrists really shows that we need to invest more in the mental health space.
The panel discussion also touched on the cultural changes communities are forced to make, all owed to COVID-19. This too brings additional psychological challenges to society and at times unwillingness from the community to adhere to the set regulations. Kengos says the trauma brought about by COVID-19 has created an opportunity to rebuild and strengthen systems. She called for conversation of this nature to become a national norm. Emal Seibeb, NBC News, Windhoek.